A pet sitter is planning to offer their services to various clients and needs to create a service agreement. What essential clauses should be included in the service agreement to ensure that both the pet sitter and the client are protected legally? Answer: a comprehensive pet sitting service agreement should include the following key clauses. Scope of services. Clearly define the services being provided, such as feeding, walking, administering medications, and any other specific duties. Duration and schedule. Specify the start and end dates of the service, as well as any agreed upon schedules for pet care, e.g. daily visits, overnight stays. Payment terms. Outline the fee structure, payment schedule, e.g. deposits, full payments, and late payment penalties. Emergency procedures include a clause on how emergencies will be handled, specifying the pet sitter's authority to seek veterinary care and who will bear the costs. Liability waiver. Limit the pet sitter's liability in case of injury or loss to the pet, property, or others, as long as the pet sitter is not negligent. Insurance. If applicable, specify the type of insurance coverage the pet sitter holds, e.g. pet liability insurance, bonding, etc., and any requirements for the client to have insurance for their pet. Termination clause. Outline conditions under which either party may terminate the agreement, such as a breach of terms or unforeseen circumstances. Confidentiality. Protect client privacy by ensuring that any personal information shared during the course of the service remains confidential. A well-structured service agreement minimizes misunderstandings and protects the interests of both the pet sitter and the client, ensuring compliance with relevant laws and regulations. Why is it essential for a pet sitter to obtain liability insurance, and what does it typically cover in terms of risks involved with pet care? Answer: liability insurance is critical for pet sitters as it protects them from legal and financial repercussions arising from accidents or negligence that may occur during the provision of pet sitting services. Key areas typically covered by liability insurance for pet sitters include injury to the pet. If the pet is injured while in the sitter's care, liability insurance can cover the costs of veterinary care or compensation to the owner if the injury is caused by the sitter's negligence. Property damage. If damage occurs to the client's property during the pet sitting service, e.g. a broken vase during a pet's playtime, insurance may cover the costs. Injury to third parties. If the pet injures someone else, such as a visitor or passerby, the sitter's liability insurance would cover medical expenses or legal fees arising from the incident. Legal costs. If the pet sitter is sued for negligence or failure to meet contractual obligations, liability insurance can help cover legal defense fees, settlements, or judgments. Without proper liability insurance, pet sitters may face significant financial risks, including lawsuits, which could threaten their business and personal assets. Sarah, a professional pet sitter, has just been hired to care for a dog that has a history of aggressive behavior when exposed to strangers. The owner has assured Sarah that the dog will be confined to a secure yard, but Sarah is concerned about the safety of herself and others in case of an unexpected situation. What actions should Sarah take to mitigate the risks associated with this situation? Answer: in this scenario, Sarah should consider the following actions to protect herself, others, and the dog. Review local animal control laws. Sarah should first review local animal control regulations regarding aggressive animals, including laws about liability and the requirements for handling potentially dangerous pets. Discuss safety measures with the client. Sarah should clearly communicate her concerns to the dog's owner and discuss additional safety measures such as the use of a muzzle crate or leash when interacting with the dog, even if the dog is in the yard. Obtain written confirmation. Sarah should ensure that the pet sitting contract includes specific provisions regarding the dog's behavior, emergency procedures, and acknowledgement of the risks involved. Insurance consideration. Sarah should check that her liability insurance covers injuries resulting from the actions of aggressive animals. She may need to update her insurance policy if she frequently cares for pets with known behavioral issues. Emergency preparedness. Sarah should have a plan in place in case of an emergency, such as an attack on a third party, and have immediate access to local animal control services or a veterinarian. What are the primary responsibilities of a pet owner in relation to the welfare of their pet, and how do these responsibilities align with legal and ethical obligations? Answer: pet ownership involves both legal and ethical responsibilities designed to ensure the welfare and safety of the pet as well as the well-being of others. Key responsibilities include provision of basic needs. Legally, pet owners are required to provide for the pet's basic needs, including food, water, shelter, and appropriate veterinary care. In many jurisdictions, failure to meet these basic needs may constitute animal neglect or abuse under animal welfare laws. Regular veterinary care. Pet owners are responsible for ensuring that their pets receive regular health checkups, vaccinations, and necessary medical treatments. Many states and countries require pet owners to maintain up-to-date vaccinations to prevent the spread of disease, proper containment and supervision. Pet owners must ensure their pets are properly confined and supervised to prevent harm to the pet, others, or property. Legal compliance. Pet owners must adhere to local animal control laws, which may include breed-specific legislation, leash laws, and noise ordinances. Non-compliance with these laws can result in fines or other penalties. Ethical treatment. Ethically, pet owners are expected to treat their pets with compassion, respect, and kindness. What unique care considerations should a pet sitter be aware of when caring for an exotic pet, such as a reptile, compared to a more common household pet like a dog or cat? Answer: when caring for exotic pets such as reptiles, pet sitters must be aware of the following key considerations. Environmental requirements. Reptiles often have very specific temperature, humidity, and lighting requirements that must be met to ensure their health. For example, some reptiles, like snakes and lizards, require heat lamps or UV beat lighting for proper digestion and metabolic function. Pet sitters should ensure that these environmental conditions are consistently maintained. Dietary needs. Unlike dogs and cats, reptiles typically require live food, e.g., insects, small rodents, or specialized food items. Pet sitters should understand the dietary requirements for each species, including frequency and portion size, to prevent malnutrition or digestive issues. Handling. Many reptiles have a more sensitive temperament compared to common pets. They may become stressed or defensive if handled improperly, which can lead to injury or health issues. Pet sitters should learn the correct methods for handling each species to reduce stress and avoid harm to the animal. Hygiene and cleaning. Reptiles often require specialized cleaning routines for their enclosures, including removing uneaten food, feces, and debris. Pet sitters must be vigilant about maintaining a clean habitat to prevent bacterial infections and other health problems. Veterinary care. Some exotic pets are prone to unique health issues such as metabolic bone disease in reptiles or respiratory infections. Pet sitters should familiarize themselves with the common health issues specific to the species they are caring for and be prepared to seek appropriate veterinary care if needed. By understanding and addressing these species-specific needs, pet sitters can provide the highest level of care to exotic pets while ensuring their health and safety. What steps should a pet sitter take to ensure they are complying with privacy and confidentiality laws when handling sensitive client information? Answer: to comply with privacy and confidentiality laws, pet sitters should take the following steps. Secure storage of personal information. Pet sitters should ensure that all client information such as personal contact details, pet health records, and payment history is stored securely. This may involve using encrypted digital systems or locked physical storage for hard copies. Discretion in communication. When discussing client or pet-related matters, pet sitters should avoid sharing sensitive information with unauthorized individuals. This includes refraining from discussing a client's personal situation or pet's medical needs in public or social settings. Written consent for information sharing. Pet sitters should seek written consent from the client before sharing any information with third parties, such as veterinarians or other service providers, unless it is an emergency. Compliance with data protection regulations. Pet sitters must familiarize themselves with and comply with relevant data protection laws, such as GDPR, General Data Protection Regulation, or other local privacy laws depending on their location. Training and awareness. Pet sitters should undergo regular training to stay informed about privacy laws and best practices for handling sensitive client information. What are the key differences between a service agreement for pet sitting and a standard employment contract, and why is this distinction important in terms of legal protections for the pet sitter? Answer: a service agreement for pet sitting differs significantly from a standard employment contract in several key ways. Nature of relationship. A service agreement is typically an independent contractor arrangement, whereas an employment contract establishes an employer-employee relationship. This distinction is important because an independent contractor is generally not entitled to benefits such as health insurance, retirement contributions, or unemployment benefits which are afforded to employees. Tax implications. Pet sitters operating under a service agreement are responsible for paying their own taxes, including self-employment tax, while employees have taxes withheld by their employer. Liability. In a service agreement, the pet sitter is typically responsible for their own liability insurance, while employees may be covered by the employer's insurance. This distinction affects the amount of risk the pet sitter is exposed to. Termination terms. An employment contract typically includes provisions for dismissal, severance pay, and other employment-related terms, whereas a service agreement is more flexible and may allow either party to terminate the contract with limited notice. Understanding the differences between these two types of contracts is crucial for pet sitters to protect their rights and ensure that they are not inadvertently treated as employees, which could result in unanticipated tax liabilities or loss of independence. James is a pet sitter who has just started caring for a border collie for the first time. He has previously cared for several Labrador retrievers but is unfamiliar with the behavioral differences between these breeds. What should James consider when adapting his care techniques for the border collie? Answer: James should take into account the following behavioral differences and adapt his care approach for the border collie. Energy levels. Border collies are highly energetic and require significant physical exercise and mental stimulation. Unlike Labradors, who are generally more relaxed and social, border collies may exhibit anxiety or destructive behavior if they do not receive enough stimulation. James should incorporate activities like agility training or puzzle games to keep the border collie mentally engaged. Independence. Border collies are known for being more independent and may not seek as much attention as Labradors, who tend to be more affectionate and attention-seeking. James should ensure that the border collie has opportunities to engage in independent play while monitoring its behavior for signs of stress or anxiety. Trainability. Border collies are highly intelligent and respond well to structured training. James should use positive reinforcement techniques and establish clear boundaries to help the border collie learn commands quickly. Exercise needs. While both breeds need regular exercise, the border collie requires more intensive physical and mental activities such as long runs, herding activities, or obedience training. How do animal control laws impact the responsibilities of pet sitters when handling potentially dangerous dogs, and what steps should a pet sitter take to ensure compliance with these laws? Answer: Animal control laws often require pet sitters to follow strict protocols when handling potentially dangerous dogs. Key responsibilities include proper containment. Pet sitters must ensure that dangerous dogs are securely confined during their visits to prevent harm to the dog, the pet sitter, or others. This may include using leashes, muzzles, or secure enclosures. Compliance with breed-specific legislation. Some areas have breed-specific legislation that regulates or prohibits certain breeds deemed dangerous. Pet sitters should be aware of these laws and avoid accepting service requests for banned breeds unless they have the proper experience and equipment. Risk assessment. Pet sitters should assess the dog's behavior prior to agreeing to care for it. If the dog shows signs of aggression, the sitter should take extra precautions and may choose to refuse service if they feel unsafe. Liability considerations. Pet sitters should carry liability insurance that covers the risk of injury from dangerous dogs, as many local laws may hold them accountable for damages caused by the pet under their care. What should a pet sitter do if a client breaches the terms of their service agreement, such as failing to pay on time or refusing to provide necessary medical care instructions? Answer: If a client breaches the terms of their service agreement, the pet sitter should take the following steps. Communication. The pet sitter should first address the issue directly with the client, discussing the breach in a professional and courteous manner. It may be that the client is unaware of the issue or there is a simple misunderstanding. Review the contract. The pet sitter should review the contract to ensure that the breach is clearly defined and what actions are allowed under the agreement in the event of non-compliance. Provide a written warning. If the issue persists, the pet sitter should send a written warning outlining the breach and the steps that need to be taken to resolve the situation, such as paying overdue fees or providing medical instructions. Termination of services. If the issue remains unresolved and the breach is significant, the pet sitter may decide to terminate the contract following the termination clause outlined in the service agreement. Taking these steps ensures that the pet sitter maintains professional standards and complies with the contractual terms while also protecting their legal interests. A pet sitter is caring for a dog when the dog suddenly begins vomiting, has trouble breathing, and shows signs of lethargy. What steps should the pet sitter take to ensure the dog receives the appropriate emergency care? Explain the best course of action, including legal and procedural guidelines. Answer: The pet sitter must act swiftly and follow the following steps. Assess the situation. First, the pet sitter must assess the pet's condition to understand the severity. Signs like vomiting, trouble breathing, and lethargy are concerning and could indicate a serious medical emergency like poisoning, respiratory distress, or shock. Contact the owner. According to best practices, the pet sitter should immediately contact the pet's owner, especially if the pet's medical condition could be an ongoing issue, e.g., chronic conditions or emergencies related to the pet's medical history. Contact emergency veterinary care. The pet sitter should call an emergency veterinary clinic or the pet's regular vet to inform them of the situation. Many veterinary clinics have emergency protocols that include handling serious cases over the phone and providing advice on immediate first aid. Transport to veterinary facility. If advised by the veterinary clinic, the pet sitter should transport the pet. Emergency transport should be handled calmly and safely. The pet should be placed in a carrier or safely restrained in the vehicle to avoid further injury. Documentation. Record all actions taken, including communications with the pet owner and veterinary clinic, as well as the pet's symptoms and response to any first aid measures. This documentation can help provide clarity in case of any legal or insurance claims. Legal considerations. Pet sitters should ensure that they have written consent from the pet owner to seek emergency veterinary care. The National Association of Professional Pet Sitters (NAPS) emphasizes the importance of obtaining this consent as part of the pet sitting agreement. Additionally, pet sitters must be aware of the local laws surrounding pet care, as some jurisdictions may have specific requirements for medical treatment or emergency care. What are the most common medical emergencies in pets that a pet sitter should be able to recognize, and how should a sitter respond to these emergencies? Provide a detailed explanation of each type of emergency and the immediate response. Answer. Pet sitters must be able to recognize and respond to a variety of medical emergencies. Some of the most common medical emergencies in pets include severe bleeding signs, profuse bleeding, whether from a visible wound or internal bleeding. Response. The pet sitter should apply pressure to the wound with a clean cloth or bandage, elevating the injured area if possible. Immediate veterinary care is necessary. Choking signs. Pawing at the mouth, excessive drooling, difficulty breathing. Response. The pet sitter should attempt to remove the object causing the obstruction if visible and safe to do so. If unsuccessful, the pet sitter should immediately transport the pet to an emergency clinic. Heat stroke signs, rapid breathing, vomiting, lethargy, glazed eyes. Response. Move the pet to a cooler environment, apply cool, not cold water to the pet's body, and seek immediate veterinary attention. Seizures. Signs. Uncontrolled shaking, loss of consciousness, drooling. Response. Ensure the pet is in a safe environment away from objects that could cause injury. Do not attempt to restrain the pet. Call a veterinarian for advice. Poisoning and vomiting, diarrhea, lethargy, drooling. Response. The pet sitter should immediately contact a veterinarian or animal poison control for instructions on how to induce vomiting or other steps to mitigate the effects of poisoning. Pet sitters should have a solid understanding of these medical emergencies and respond promptly while maintaining a calm demeanor. Jane is a professional pet sitter assigned to care for a dog named Max, a large breed known for being protective of its owner. While Jane is feeding Max, the dog suddenly growls and shows aggressive behavior after she tries to take the food bowl away. What should Jane do in this situation to ensure her safety and the safety of the pet? Answer. Jane should follow these steps. Avoid confrontation. Jane should avoid making any sudden moves or attempting to take the bowl away at this moment. Trying to force the dog to release the bowl could escalate the situation. Remain calm and non-threatening. Jane should remain calm and adopt non-threatening body language. Avoiding eye contact with the dog, standing sideways to the dog. Her posture should be relaxed to avoid further agitating the dog. Give the dog space. She should slowly and calmly back away from the dog, giving Max the space he needs to calm down. If Max feels cornered, his aggression may escalate. Assess the situation. Jane should assess why Max is aggressive. It could be due to fear, resource guarding, or a sudden change in environment. Identifying the cause of aggression helps to address the root problem in future interactions. Contact the owner. Jane should contact Max's owner to inform them of the situation and ask for guidance on handling aggression. Implement safety protocols. If Jane feels unsafe, she should remove herself from the area and avoid further interaction with the dog until the owner or a professional trainer can intervene. During a hurricane warning, a pet sitter must evacuate the pets in her care. What factors should she consider to ensure the safety of the pets and follow legal evacuation protocols? Answer. The pet sitter must ensure that the evacuation process is safe, swift, and well organized. Key steps include pre-evacuation planning. Prior to an emergency, pet sitters should have an evacuation plan in place. This should include the identification of safe shelter locations that accept pets and have adequate facilities, e.g., kennels, evacuation centers, or a pet-friendly hotel. The plan should also consider pet carriers, leashes, and medical records. Transport considerations. Pet sitters should ensure that pets are transported securely in carriers. This prevents stress and injury during transport. If transporting multiple pets, the sitter should make sure the vehicle is large enough to accommodate them safely. Documentation and identification. Pet sitters should ensure pets have proper identification, such as collars with tags and microchips. Documentation of each pet's medical history, vaccinations, and any special needs should be readily accessible during evacuation. Communication. The pet sitter should inform the pet owners immediately about the evacuation process and the location of the pets. It's critical to maintain communication throughout the evacuation to reassure clients and make necessary arrangements. Post-evacuation care. Once in a safe location, the pet sitter should monitor the pets for signs of stress or injury and ensure they have access to food, water, and medical care if needed. Legal requirements. Some local regulations require pets to be evacuated in case of natural disasters. Additionally, pet sitters may be held liable if the pet is harmed during the evacuation process, so ensuring proper planning and communication is crucial. A client's cat, Charlie, cuts his paw pad while playing outside. The injury looks deep and is bleeding profusely. What immediate first aid steps should the pet sitter take, and how should they handle the situation professionally? Answer: the pet sitter should take the following steps. Stop the bleeding. Apply direct pressure to the wound with a clean cloth or sterile gauze. This helps to control the bleeding. Clean the wound. If the bleeding stops, gently clean the wound with a saline solution or antiseptic wipes to remove dirt and debris. Avoid using hydrogen peroxide as it can damage tissue. Bandage the paw. If the wound is still bleeding or open, wrap it with a sterile bandage to protect it from dirt and prevent further injury. The bandage should not be too tight as it could restrict blood flow. Contact the veterinarian. Even if the bleeding stops, the pet sitter should contact the veterinarian to determine if further care is necessary, e.g., stitches, pain management. The veterinarian may also suggest bringing the cat in for an evaluation. Client communication. Inform the client about the injury and the steps taken. Include details of the injury, first aid performed, and the veterinarian's advice. Transparency is essential in maintaining trust. What strategies should a pet sitter use to ensure clear and effective communication with their pet owner before, during, and after sitting assignment? Discuss how the sitter can manage expectations and keep the owner informed. Answer: effective communication with pet owners is essential for ensuring smooth pet sitting experiences. The pet sitter should use the following strategies. Pre-sitting communication. Before the assignment, the pet sitter should meet with the owner to discuss the pet's needs, preferences, daily routine, and any medical conditions. A detailed written pet care plan should be created, including emergency contact numbers, routine information, and special instructions during the sitting assignment. Pet sitters should provide regular updates to the owner, whether through texts, phone calls, or photos. This reassures the client and helps address any issues early. Clear communication about any changes in the pet's behavior or health is crucial. Post-sitting communication. After the assignment, the pet sitter should provide a detailed report including any observations, changes in the pet's behavior, and any incidents that occurred. This report should also include an assessment of the pet's overall well-being. Managing expectations. Setting realistic expectations from the outset is key. Pet sitters should make it clear what services they offer, including any limitations due to the pet's behavior or health. This helps avoid misunderstandings and builds trust. A pet sitter receives a complaint from a client about the behavior of their dog during a sitting assignment, stating that the pet sitter was not following the agreed-upon schedule. How should the pet sitter professionally respond to this complaint and resolve the situation? Answer: the pet sitter should follow these steps. Acknowledge the complaint. The first step is to acknowledge the client's concerns without becoming defensive. Acknowledge that the client's feelings are valid and that the issue will be addressed. Review the situation. The pet sitter should review the details of the sitting assignment, including the agreed-upon schedule, care plan, and any communication regarding the pet's behavior. If there were any deviations, the sitter should identify the reason, e.g., unforeseen behavior issues, personal limitations. Provide a clear explanation. The pet sitter should explain the situation clearly, providing a reason for any changes in the schedule or actions taken. It's important to be transparent while maintaining professionalism. Propose a solution. After acknowledging the issue, the pet sitter should offer a solution. This could include offering a partial refund, resitting the pet at no additional charge, or adjusting future care plans to better meet the client's expectations. Document the resolution. After addressing the issue, the pet sitter should document the conversation and agreed-upon solutions for future reference. What techniques can a pet sitter implement to enhance customer satisfaction and differentiate themselves from competitors in a competitive market? Answer: to enhance customer satisfaction and service quality, a pet sitter can offer personalized care, tailor pet care services to each pet's unique needs and preferences, such as specific playtime routines or dietary restrictions. Going above and beyond in caring for the pet's well-being creates a positive experience for the client. Stay consistent and reliable. Punctuality and reliability are key. Clients appreciate knowing that their pets will be taken care of at the exact times scheduled without last-minute changes. Provide regular updates. Sending regular updates about the pet's well-being, along with pictures and videos, makes pet owners feel more secure and connected with their pets during the sitting period. Offer extras. Providing extra services such as dog walking, grooming, or administering medications at no extra charge can differentiate a pet sitter from competitors and increase customer loyalty. Solicit feedback. After each assignment, the pet sitter should ask clients for feedback and use this to improve future services. Regularly checking in with clients also strengthens relationships and encourages repeat business. A pet sitter notices that a dog in their care is displaying signs of separation anxiety, including barking and destructive behavior when left alone. What steps should the pet sitter take to manage this behavior and ensure a safe environment? Answer: steps to manage separation anxiety include: provide comfort and reassurance, avoid making a big fuss when leaving or returning to the pet, gradually desensitize the dog to departures and arrivals by starting with short departures and slowly increasing the time, offer mental stimulation, provide toys, puzzles, or chew items to keep the dog occupied. Mental stimulation helps reduce anxiety and prevent destructive behavior. Create a safe space. Designate a comfortable and quiet area where the dog feels secure. This space should have familiar items like the dog's bed and toys to create a sense of security. Maintain a routine. Stick to a consistent routine for feeding, walks, and playtime to help the dog feel more secure and know what to expect throughout the day. What steps should a pet sitter take when dealing with a pet emergency, especially when communicating with the pet's owner during such a crisis? Answer: in an emergency, clear communication with the owner is vital. Provide immediate updates. As soon as an emergency arises, the pet sitter should contact the pet owner to inform them of the situation, detailing the pet's condition and any actions already taken. E.g., calling the vet, administering first aid, follow up regularly, keep the owner updated throughout the emergency, letting them know when the pet is being transported to a vet or when veterinary care has been administered. Offer reassurance. If possible, reassure the owner that everything is being done to provide the pet with the best care. This can help reduce the emotional stress on the owner during a difficult time. Ensure transparency. Once the emergency is over, provide the owner with a full report detailing what happened, the actions taken, and any recommendations for future care. A pet sitter has several clients who request pet sitting services during peak vacation seasons. How should the pet sitter prioritize and manage these requests to ensure they meet all their clients' needs without overcommitting themselves? What considerations should be factored in when creating an effective scheduling plan? Answer: in managing multiple pet sitting requests, a pet sitter should consider several factors to balance client needs with their capacity to deliver high-quality care. The following steps should be taken. Prioritize based on client urgency and care requirements. If a client requires special attention, e.g., administering medication or managing behavioral issues, this should be factored into the schedule first. Assess time constraints. Review the pet sitter's available hours and make sure there is enough time to devote to each client without overlapping visits. Buffer time. Include extra time between bookings for travel and to handle last-minute issues, ensuring that no visits are rushed or late. Communication. Clear communication with clients regarding availability and expectations is key, especially during busy periods. In case of overlapping requests, the pet sitter should offer alternative dates, times, or recommend other trusted sitters if necessary. Guidelines. According to the National Association of Professional Pet Sitters, (NAPS), professional pet sitters should maintain realistic schedules to avoid burnout and ensure they deliver quality care. What are the specific care needs of reptiles compared to mammals and birds, and how should a pet sitter adapt their approach when caring for a reptile? Answer: reptiles, unlike mammals and birds, have distinct care needs related to temperature regulation, feeding, and habitat conditions. Key points to consider include temperature and humidity. Reptiles are ectothermic, meaning their body temperature is regulated by the environment. A pet sitter must ensure that the reptile's enclosure maintains the proper temperature gradient, warm and cool areas, and humidity levels. Feeding. Reptiles have specific dietary needs based on their species, e.g., herbivores, carnivores, omnivores. Pet sitters must be knowledgeable about the appropriate food and feeding frequency. Enclosure maintenance. Reptiles often require specialized lighting, for vitamin D synthesis and filtration systems for aquatic species, handling, and like birds or mammals, reptiles typically prefer minimal physical interaction. Handling should be limited and gentle, following the species-specific guidelines, NAPPS guidelines. When caring for reptiles, pet sitters should educate themselves about the species-specific requirements. Reptiles have unique behavioral traits and environmental needs that must be met for their health and safety. Sarah is a professional pet sitter who is committed to taking care of 3 clients during the holiday season. Client A requires daily visits to feed and administer medication to an elderly dog. Client B needs pet sitting for 2 cats that are very skittish, and Client C has 2 energetic dogs that need frequent exercise. How should Sarah balance these requests while ensuring quality care and avoiding overcommitting herself? What steps should she take to prevent schedule conflicts? Answer: in this scenario, Sarah should assess the time and energy required for each client. Client A visits might take €3 for 5 minutes per day due to medication and elderly care, while Client B's visits might require 45 minutes to 1 hour due to the skittish behavior of the cats. Client C may need 1-2 hours for exercise and playtime. Plan visits based on distance and time. Sarah should aim to group nearby clients together to minimize travel time. Client A, with a fixed schedule due to medication, should be prioritized in the morning, while Client C's dogs can be scheduled for afternoon visits when they are more energetic. Allocate buffer time. She should plan for at least 3 minutes between clients to accommodate unexpected delays or to handle last-minute client requests. Set realistic boundaries. If Sarah cannot meet the demands of all 3 clients without feeling overwhelmed, she should communicate this early, offering alternative solutions or suggesting other trusted pet sitters. Use technology. Sarah can use scheduling software or apps to track her appointments and avoid any overlaps or missed visits. How can a pet sitter create a standardized routine for pet sitting visits to ensure all pets receive consistent care, and how should deviations from the routine be handled? Answer: a standardized routine for pet sitting should include consistent feeding schedule, ensure that pets are fed at the same time each visit, as many animals thrive on routine. Specific instructions regarding portion size and special dietary needs should be followed carefully. Exercise and playtime. Include time for exercise or play based on the pet's energy level and breed requirements. This should be a set duration for each visit, e.g. 20 minutes of playtime or a 30-minute walk. Hygiene care. Include regular checks for litter box cleaning, waste disposal, and any necessary grooming. Medical care. If medication or special treatments are required, these should be given at the specified times as per client instructions. Routine updates. A written or digital log should be maintained for each pet's care, so clients can track their pet's well-being and behavior during the sitting. When deviations from the routine occur, e.g. due to illness or accidents, pet sitters should immediately contact the pet owner and update them on any changes. Proper documentation of deviations is essential to maintain trust and professionalism. A client has cancelled their pet sitting request just 1 day before the scheduled visit due to a change in plans. How should a professional pet sitter handle this situation, and what are the best practices for dealing with last-minute cancellations? Answer: when handling last-minute cancellations, a professional pet sitter should refer to the cancellation policy. If the pet sitter has a clear cancellation policy in place, e.g. a certain notice period or cancellation fee, this should be communicated and enforced according to the terms. Maintain professionalism. Even if the cancellation is unexpected, the pet sitter should remain professional and express understanding of the client's situation. Offer flexibility or alternative services. If the pet sitter has time and capacity, they could offer to reschedule the visit or suggest other pet care options. Update availability. If the cancellation allows for more time or availability, the pet sitter may reach out to other clients to fill the schedule. NAPPS guidelines. The NAPPS Code of Ethics includes maintaining clear policies on cancellations and other scheduling issues to manage client expectations and protect the pet sitter's business interests. What steps should a pet sitter take when providing medical care for exotic or non-domestic pets, such as reptiles, to ensure their well-being while avoiding potential harm or mismanagement? Answer: when providing medical care for non-domestic pets, a pet sitter should understand the species-specific health needs, research the common illnesses, medical conditions, and medications for the species they are caring for, follow veterinary instructions precisely. If the pet sitter is administering medication or special care, they should follow all instructions from the vet to ensure the pet's safety. Monitor vital signs. Regular monitoring of vital signs like temperature, humidity for reptiles, or signs of distress is essential to avoid any health complications. No emergency protocols. A pet sitter should be familiar with the emergency contact procedures for a veterinarian specializing in exotic animals and know when to seek professional help. Record everything. All medical treatments, medication, and health changes should be documented and communicated to the pet owner. NAPPS guidelines. The NAPPS encourages specialized training for exotic pet care and emphasizes that pet sitters should only offer medical care within their training and expertise, referring to professionals when necessary. What are the key considerations for a pet sitter when caring for large animals such as horses, and how does the care for horses differ from that of typical domestic pets? Answer: caring for large animals like horses requires attention to feeding and nutrition. Horses require a balanced diet based on their size, age, and activity level. Pet sitters must ensure they are fed appropriate hay, grains, and water. Exercise. Regular exercise and mental stimulation are important, particularly for horses. Grooming and turnout time are part of the routine. Health monitoring. Routine health checks for signs of illness, injury, or lameness are critical. Pet sitters should be knowledgeable about common equine health issues such as colic or laminitis. Safety precautions. Large animals pose physical risks, so it's important that pet sitters follow proper safety protocols when handling them. This includes using appropriate handling equipment, e.g. lead ropes, halters, and understanding their behavior. NAPPS guidelines. Pet sitters should only take on large animal care if they have specific experience or training in equine or livestock care, ensuring that they can manage the safety and well-being of the animals. How can a pet sitter effectively handle time management challenges when faced with multiple clients needing care at the same time, particularly when one client requests additional services such as grooming or administering medication? Answer: a pet sitter should evaluate the time commitment for each task. Grooming, administering medication, or providing special care requires more time than standard visits. Prioritize tasks based on urgency. If medication is time sensitive or if a pet has specific dietary needs, those tasks should be prioritized. Communicate with clients. If the pet sitter is unable to meet all demands due to time constraints, they should discuss and manage expectations, possibly suggesting an alternative time slot. Use time blocks. Creating structured time blocks for each task can help manage overlapping requests and avoid overbooking. NAPPS guidelines. Effective time management is critical to maintaining professional standards and ensuring pets' needs are consistently met. NAPPS advises pet sitters to set clear boundaries around service offerings, including time limits for each pet care task. What are the primary concerns when providing care for small mammals, such as rabbits or guinea pigs, and how should a pet sitter tailor their care routine for these pets? Answer: small mammals have unique care requirements. Diet: they require fresh vegetables, hay, and specific pellets with water available at all times. Living environment: small mammals should have a clean, safe enclosure with enough space for movement. Rabbits, for example, need regular exercise and mental stimulation outside of their cage. Grooming: depending on the breed, regular grooming may be necessary, especially for long-haired breeds. Health checks: small mammals need regular health checks, including monitoring their teeth, ears, and nails for signs of illness. NAPPS guidelines. Pet sitters caring for small mammals should be knowledgeable about their species-specific needs and ensure the environment is safe and enriching. They should also communicate any health concerns with the pet owner promptly. How can a pet sitter manage overlapping pet sitting assignments, particularly during high-demand seasons like holidays, while ensuring each pet receives personalized and adequate care? Answer: to manage overlapping assignments, use scheduling software or planners to track multiple bookings and prevent double booking. Allocate specific time slots for each pet's visit and include buffer time between appointments. Prioritize clients based on urgency. If a client has a sick pet or urgent care needs, they should be scheduled earlier in the day. Set expectations with clients. Clear communication about visit durations and timing will help manage expectations and avoid last-minute changes. NAPPS guidelines. Time management is key in ensuring that the pet sitter's commitments are met without compromising care quality. NAPPS encourages pet sitters to remain organized and clear in their communication to ensure professional standards.